they stop the sympathetic outflow, correct? So that's, can anyone remember the name of the drug? He said the drug that we use to treat pregnancy with hypertension. Methyl dopa. Remember that? So methyl dopa is a central, we said that this is a central drug. It acts on the CNS. It actually is converted inside the body into methyl noradrenaline. And this will activate the alpha-placental receptors, and that will stop the sympathetic outflow. And this will reduce the blood pressure. So we found that there is polymorphism in this protein is the blocker of this channel. Okay, this drug was also found in clinical trials to reduce the risk of hospitalization. Okay. So if I ask you now, like, you have to be careful about the wording here. When you say that ivermectin, like, treats heart failure, would that be a correct statement? No, that's not an. I mean, we can, like, if you're talking in the TV or in public, that could be fine. But to be like in a scientific forum or in a class teaching pharmacology, you cannot say that it treats heart failure. Okay, we know that from clinical trials, it reduces the hospitalization, but it doesn't treat heart failure. Okay, so you have to be careful about that. I'm not gonna ask you questions like this in the exam, but I'm just like giving you a hint about using, when you used to describe this drug or teach about this drug, you have to be careful about wording. You cannot say that, hey, it treats heart failure. It doesn't treat heart failure. It just reduces hospitalization. That's the knowledge we know about this drug at the moment. Okay, so again, this is like we're showing you the heart cells here inside the cell, and here is the outside. And we can see that this is the sodium channel we're talking about. And we can see here that the cyclic AMP is controlling the gate of the channel. So this diagram can always remind you that the nucleotide or the cyclic nucleotide is actually the cyclic AMP. Now, it's a little bit complicated mechanism, but we'll go through it step by step. So it reduces the spontaneous hyperactivity of the cardiac sinus node by inhibiting the funny currents or inhibiting the sodium channel. So based on that, you should expect that there will be a decrease in the heart rate. Okay? So there will be a decrease in the heart rate only because it acts on the spontaneous pacemaker. The contractility of the heart will not be affected. We're just affecting the heart rate. Okay, so this is very important to know. It does not reduce the contractility of the heart. It just reduces the heart rate. Okay, and also does not have any effect on ventricular repolarization. So what I'm showing you here on the left is, you can see that the control is the gray color. That's here the action potential. So we can see here, this is from here to here. This is a single action potential. Okay. Now, when you start giving the drug, look at the yellow color. From here to here, you start to see that there is an increase in the duration of the action potential. So the action potential has a duration which is measured by milliseconds. Okay, when you prolong this, okay, this means that the heart rate will decrease because the heart rate is produced by this action potential. So when you increase the duration of the action potential, you are decreasing the heart rate. Okay, so if we ask you a question in the exam that the ivermectin decreases the duration of action potential, would that be true or false?
Oh,
false.
That's fucking beautiful.
Yeah, that would be false. So this is an inverse relation. This is a cardiovascular most death. That's the difference. Reduces cardiovascular or heart failure hospitalization. This is economically very important. One of the problems of this heart failure patients is that they usually require hospitalization every few years or sometimes every few months. So this is a load on the patient and a load on the health insurance, a load on the government. So reducing hospitalization is one of the main objectives of treatment of heart failure. Reduction in myocardial infarction, improved heart failure symptoms, and all of these effects primarily believed to be mediated through beta-1 receptor signaling. Okay. So vasodilators. Can we use vasodilators in heart failure? I think it's a good approach. The answer is yes. Why would we use vasodilators? Because they will decrease the preload. Okay, and decreasing the preload can definitely. I'm sorry. They will increase the preload. So when you increase the preload, that will improve the contractility of the heart. So we talked about dilators, and we said that we have arterial dilators, we have venous dilators, and we have mixed dilators. Okay. One of the drugs that proved to be very beneficial in heart failure is known as the bi-del. And from the name, you can predict its function. So bi, because there are a combination of two drugs, hydralazine and isosorbide dinitrate, and both of them induces vasodilation. Okay, so bi-del indicates by dilation. Del here stands for dilation, or vasodilation. So the bi-del, combination of hydralazine and isosorbide dinitrate, and it was shown to extend survival.
What an
And
ending.
in cases of the acute decompensated conditions, we said that